I'm an American board certified OBGYN, a mom, a Muslim, and I'm talking about sex. This is the Muslim Sex Podcast. Welcome to the Muslim Sex Podcast. I'm your host, Dr. Sadaf Lodhi. And here with me in the studio today is Rafia Lodhi.
Hey guys, from North Carolina.
So this episode today is everything that you want to know about hormone replacement therapy. But before I get into it, the first thing I want to make very clear is that I'm not giving any kind of medical advice. So if you have any concerns about your health, please speak with your health provider. And if you have any questions about your religion, please ask your friendly neighborhood religious leader. This is the Muslim Sex Podcast because I just happen to be a Muslim woman that talks about sex. So today, like I said, we're going to be talking and discussing hormone replacement therapy. So hormone replacement therapy is typically given to women once they reach menopause. And as you recall, and I'm sure our viewers recall, is when we go a whole year without any period at all. And so then we're considered to be in menopause. And typically women seek hormone replacement therapy if they're having a lot of symptoms, such as what we would call in the medical field vasomotor symptoms, or hot flashes, night sweats, mood swings, things of that nature. And a lot of times those become so troublesome that it's difficult for women to continue with their activities of daily living. And so they'll go and talk to a provider, whether it be their primary care doctor or their gynecologist. And they'll typically ask for help with those symptoms. Now, we used to think that those symptoms didn't last very long, but we now realize through research that they actually last about 7.5 years. So that's a long time. And if you're thinking that menopause starts around the age of 51, then that takes us almost to the age of 60, which is a long time to be suffering with those complaints. Women not only experience those vasomotor symptoms, but they can also have vaginal dryness, vaginal irritation. They can have recurrent bladder infections and definitely pain with intercourse. And this is all because of the decreased estrogen that we have in our bodies.
Mm-hmm. Is there one specific sign that a woman should look for that, okay, this is the key that I need hormone therapy replacement?
Yeah, that's a good question, Raf. So there isn't one symptom per se. There are multiple symptoms, but it's really what bothers you the most. Yeah. And that's what will bring the patient in to go see their provider. Now, some women aren't bothered at all by any of these symptoms, and some women don't even have any symptoms. And as they enter menopause, and they're fine, they don't require anything, any treatment. But for women that have those symptoms, and specifically those what we call genitourinary symptoms of menopause, which again, like I was saying before, is that pain with the intercourse, vaginal dryness, vaginal irritation, recurrent bladder infections, those symptoms tend to be, I would say, one of the most bothersome symptoms, and that women come in with and will ask for some type of treatment for. So when women come in for that, they also notice that they have decreased lubrication. Okay. And what we suggest oftentimes, even before we get to hormone replacement, is we'll suggest lubricants. So there's different types of lubrication and lubricants that you can use for painful intercourse, for women that are desiring that and need some help and some relief with intercourse. And what we will suggest is, oil-based. You can actually go with silicone-based and or water-based lubricants. We typically don't suggest oil-based lubricants with condoms because it can actually, especially specifically with latex condoms, because it can actually disrupt the integrity of that condom. And especially if you're using that condom to protect you against sexually transmitted infections, it can actually cause that latex condom to break. Okay. So that's why we say, don't use oil lubricants with latex condoms. You can use, again, like I stated, silicone based lubricant or a water-based lubricant with latex condoms, and that's fine. In menopause, one of the benefits of being in menopause is that you don't have to worry about getting pregnant
Hmm.
because you're not ovulating, and thus your chance of getting pregnant is none. So,
Right.
women don't use condoms for that, but they're using condoms more specifically for protection against sexually transmitted infections.
So would that also lead to like a low sex drive too for women because they don't have that lubrication as well?
Absolutely. So there's, definitely, and actually, one of our upcoming episodes, will talk about hypoactive sexual disorder,
Hmm.
that it talks, and we'll talk more about decreased libido at that time. But definitely, women in perimenopause and in menopause can experience decreased libido, and especially if you're having pain with intercourse,
Hmm.
absolutely, that's going to result in decreased libido and not wanting intercourse, right? Not
Right.
wanting to have sexual intercourse. Absolutely. So, some of the most common themes that the American College of OBGYNs and the North American Menopause Society have suggested for hormone replacement therapy is that it begin within 10 years of somebody experiencing menopause.
Hmm.
So, if the mean age for somebody to go through menopause is 51, then within 51 to within the age of 51 and 61, it's important that if you decide you want hormone replacement, that you get placed on it at that time. And again, like we stated before, it's the lowest dosage for the least amount of time. And after 3 to 5 years, physicians will often recommend women to go off of hormone replacement and or start to taper that dose so that eventually they can come off. The reason why they suggest women to come off is that there have been some studies that have shown an increased risk of breast cancer.
Mm.
And so that's one of the main reasons for coming off of hormone replacement therapy. And also, you don't want to take estrogen by itself, because, especially if you still have a uterus, because that can increase the lining within that uterus and can result in some postmenopausal bleeding, which we know can be a sign of uterine cancer.
Hmm.
And that actually brings me to a very important point, that once a woman is in menopause, if she experiences postmenopausal bleeding, it's so, so important for her to go and get evaluated to make sure that she gets ruled out for uterine cancer. Also, Rafa, like we were talking about, some of the contraindications for hormone replacement is if a woman has an increased risk of breast cancer. So that's an important risk factor. And always, go and discuss any of these concerns or risk factors with your primary care provider, because they're going to be able to assess you as a full patient as a whole, and your genetics and everything like that
Does
before they
family
place you.
history go into that as well when you were looking into hormone replacement and you were talking about breast cancer? Definitely, we should check someone's family history as well for breast cancer
Absolutely.
before they go on to hormone replacement.
Definitely their family's history. So genetics, but not only their family history, but their own history. So, for example, if they've had breast cancer, right? And
Hmm.
also if they are positive for a gene called BRCA1 or 2, which has an increased risk of breast and ovarian cancer. So that is definitely a risk factor. And it's unlikely that your provider would put you on hormone replacement, but depending on what your symptoms are, maybe they decide that risk versus benefit, and they would be the ones to discuss that option with you in detail. But yes, absolutely, you want to look at genetics and you want to look at risk factors before you placing anyone on hormone replacement.
So, should one person also look at their weight and the way they eat? Does that affect the type of hormone replacement they're placed on?
Sure. So a lot of times, what we'll do is we will talk about things that we can modify
Hmm.
before we place somebody on hormone replacement. So, for example, if they exercise may help their vasomotor symptoms. Definitely diet. Being at a healthy weight definitely helps.
Hmm.
Um, Sometimes, though, I've noticed that women that are a little bit overweight, they don't have as much, they may not have as much issues with, um, vaginal dryness, because that increased weight that we have, those adipose cells release estrogen, and that estrogen may actually be helpful in preventing some of that discomfort with intercourse, with
Okay.
sex, because it could provide some lubrication, the excess estrogen that they
Hmm.
have. But of course, that being said, if women are obese and they go through menopause, and then say like it's been a year or two that they haven't had a period at all, and then a few years down the line they notice that all of a sudden they start to have bleeding, that definitely would be um, a red flag, and they should be evaluated, because they could have uterine cancer. So
Hmm.
again, remember, any postmenopausal bleeding that a woman experiences, she always needs to go and be evaluated
Got it.
for uterine cancer.
Good to know.
Absolutely.
Good to know.
Yeah. Yeah. So there are other therapies that women can use for vasomotor symptoms, or for hot flashes and night sweats. And what we do, again, like we were talking about, is, some non-hormonal therapies we were talking about, where lifestyle changes, some also, some antidepressants actually have helped. And one in particular is a medication called paroxetine, or Paxil.
Hmm.
And that has been used for these vasomotor symptoms, which are what we talked about: the hot flashes, the night sweats, the mood swings. And that medication has been shown to help women, and is an alternative to, for example, hormone replacement. If they don't want to go on hormone replacement, that may help.
How long can they go on this particular drug if they don't
Mhm.
want to go on the traditional route of hormone replacement therapy?
Yeah, so Paxil is an antidepressant, and again, it's actually used at a dosage lower than what it would be used for if it were being used as an antidepressant. So it's half the dosage,
Okay.
and you can stay on that for as long as you want. As long as it's helping with those symptoms of hot flashes, night sweats, mood swings, because there is no hormone associated with it. Of course, it may have its own negative side effects, because some antidepressants, and you would have to check that out, but some antidepressants actually have been associated with decreased libido and decreased desire. So, as everything comes with its benefit, but also with its risks. So you'd
Kind of
have
have
to
to
weigh those
balance
up.
it.
Yeah, yeah, definitely. And you'd have to see what works best for you.
Hmm.
Um, Also, if you decide you want to go with some hormone therapy, then that is when you would start it, which, like we said, is right around the time that you go through menopause. And, within 10 years of going through menopause, you would go on hormone replacement. And then after 3 to 5 years, your doctor would talk to you about perhaps tapering off of that medication, and see how that helps. Again, lubricants help with the pain that happens with vaginal dryness that occurs in menopause. So definitely lubricants are a good thing, and helpful. And of course, we don't want to leave out vaginal estrogen tablets or cream that you can put inside the vagina. And those effects act locally
Hmm.
within the vagina, and typically don't have as much, or have very little systemic side effects of estrogen. For example, they're not going through the bloodstream. And in fact, estrogen patch also is something that's been used, and again, doesn't go through the liver, so it doesn't have the full systemic side effects
Hmm.
that you may experience with, like, say, like an oral tablet. A lot of women, especially if they're having those genitourinary symptoms of menopause, those symptoms of the vagina and the bladder, they will prefer to use those tablets or creams that you can place inside the vagina.
Hmm.
Again, you have to be careful if you still have a uterus, because you are getting that estrogen, and that estrogen does act locally and can affect the uterus, and they can get increased thickening of the lining of that uterus, which can
Hmm.
result in postmenopausal bleeding. So, again, there's a risk versus benefit, but there are creams and tablets that are available, and even rings that are available to be used within within the vagina to help with the thinning of that vaginal lining and with the discomfort that can happen with intercourse.
So how long do you have to be on hormone replacement? Will you ever get to a point where it's like, okay, I don't need this anymore. I'm good. I've gotten over most of the symptoms. When can I
Mhm.
just live like, okay, I don't want this anymore?
Well, again, so it's like I said that, patients typically will go on hormone replacement if they're having symptoms that are really bothersome. So
Mhm.
if they decide that, they're okay with some of the symptoms or that they're not as bothersome as they used to be, then
Mhm.
they'll decide to go off of it. Most societies will recommend to go off of it by the age of 60,
Okay.
and definitely women in their 60s will not be encouraged to start a hormone replacement at that point.
All right.
It's usually like a transitory phase between when a woman first goes through menopause and up until the age of 60,
Okay.
Although again, they can discuss with their provider and some women need it a little bit longer. So again, risk versus benefit, and they'll have to discuss that.
Definitely go see your doctor to see what's right for you.
Yeah, absolutely. And that's definitely the biggest takeaway is to see what's right for you, what's working for you, and what symptoms you can manage and what symptoms you absolutely cannot, you know. And the one thing that I want to say about sex, Raf, is that since this is the Muslim Sex Podcast, is that it's important for women to remember that as we age and as we go through menopause,
Mhm.
if we're not having sex, then that vagina will actually it'll start to that lining, that tissue of the vagina actually starts to become thinner.
Mhm.
And if we are not having intercourse, and or if we're not, it's that whole cliche or that saying that if you don't use it you
You
lose
lose
it. So
it. Yeah.
basically, that vagina will start to become more narrow, and so when a woman decides to have sex, it'll become more painful for her. So
Mhm.
it's actually very important for her vaginal health to continue to have sex
Mhm.
because it'll help with that tissue, because it'll bring blood to that tissue.
Mhm.
So when women or people with, people that are born or assigned female at birth, um, when they continue to have intercourse, um, using vagina, and as we know there's more than just vaginal intercourse, there's oral sex, but specifically we're talking about vaginal intercourse, that the more you have sex, vaginal intercourse, the more that blood flow is going to come to the vagina, and it's going to help maintain that tissue integrity.
Okay.
And so the less intercourse they have, it's going to actually be bothersome, not only because that vagina will shrink and be more uncomfortable, but that tissue lining will be more prone to um, tearing because you're not using it. It's not getting that blood flow that it
Mhm.
normally would with sex.
Okay.
So that's why it's actually very important to continue to have sexual intercourse. And if you need lubricants or if you need that vaginal estrogen, it's so important to talk to your provider about that and get a prescription if you need it.
Okay.
Yeah.
Good to know.
Yep. And so I just want to make sure that I cover everything. There are also, different other medications that we can use. There's something called vaginal DHEA, which is also a different hormone. It's not estrogen, but it's a different type of hormone that can be used in the vagina to also help rebuild that vaginal tissue lining. And then there's also something called ospemifene. And also that's used again to help with that vaginal tissue lining. So there are definitely medications that can be used, and important just to seek out help when you need it. So that's what it boils down to. So that is it with hormone replacement therapy, Raf.
Don't miss your doctor's appointment. That's what I was going to say because you need to know this information no matter what.
Absolutely. And it's so important as women transition from
Mhm.
perimenopause to menopause for them to know what their options are.
Yeah.
And in terms of being treated for hot flashes, night sweats, mood swings, or even the vaginal dryness, vaginal irritation, pain with intercourse, any of those things, right? It's so important to go and have a visit with your doctor and see what your options are based on the symptoms that you're experiencing, but also based on your genetics and your risk of cancer. Okay. So, well, I am done here, and it's been real and really intimate. And remember, this is not meant to be medical advice. So please see your healthcare provider if you have any concerns at all about your health. And until next time, this is the Muslim Sex Podcast. Thanks for listening. If you'd like to schedule a one-on-one coaching with Dr. Lodhi, please visit drsadaf.com. And until next time, this is the Muslim Sex Podcast.